Okay. Senator Hassan?
Thank you, and thank you to you, Mr. Chair, for the hearing, and Ranking Member, thank you for the hearing, and thank you for your courtesy just now. Thank you to our witnesses for being here today. I really just have two questions, and I want to start with Dr. Ippolito. One of the many factors driving healthcare costs and medical debt is unfair fees for routine care, even for Americans who have health insurance. For example, I've heard from Granite Staters who've been charged hundreds of thousands of dollars for a regular doctor's visit just because, hundreds or thousands of dollars for a regular doctor's visit just because their doctor's office has been purchased by a hospital. Dr. Ippolito, can you talk about some of the root causes that are driving these higher healthcare costs and unfair billing practices?
Well, I'll stick with the example that you started with. One of the big challenges that we face right now is consolidation on the provider side, on the insurer side, throughout the system. You bring up a great example where we have a number of policies on the books that encourage lots of consolidation in the provider side. And what that allows people to do is both take advantage of rules in Medicare to charge higher prices and in the commercial market charge higher prices to anybody who walks through the door. So the combination of those two things clearly contributes to high health costs, and it surely contributes to medical debt.
And what are your suggestions about ways to curb these trends so we can protect patients from these unfair facility fees?
I mean, on this side specifically, site-neutral payment seems like number one.
Okay, thank you. Dr. Messick, I wanted just to touch with you on something you discuss in your testimony. Many of your patients that come into the emergency room, you say, are fearful of incurring medical debt. Can you speak to the impact of medical debt on a patient's decision to seek care, particularly early care?
Absolutely. I mentioned in my testimony about a patient with late-stage cancer who could have been treated early if she had showed up but feared for the costs. I also want to mention patients who come to the ED and we find that they are at risk for very serious conditions, heart attack, stroke, but we don't have that diagnosis yet, and we need them to stay for more testing, just overnight, just for more testing. This conversation comes up all the time, and they always ask, how much is it going to cost? I don't know the answer, but it'll cost them something. And oftentimes they don't stay, and we don't get that diagnosis that could save their lives.
I appreciate that. That's all I have. Thank you, Mr. Chair and Ranking Member Cassidy.
Senator Cassidy?